Thank you, Mr Deputy Speaker. I hope the Secretary of State is aware of the tragic case of Kelly Smith, who sadly died when her cancer treatment was stopped during the COVID lockdown. The government's aspiration to get cancer services back to normal by the end of the year is simply not acceptable. Too many cancers are incurable within a few weeks. Can the Minister address this issue, and will he look at transforming radiotherapy services which have emerged as being highly effective as a cancer treatment which can be delivered even if there is a second spike in the pandemic?
Yes, absolutely. The right honourable gentleman is absolutely right about the importance of this. We're getting cancer services back up and running as fast as possible. The idea that we're waiting till the end of the year before doing anything is completely wrong. We're going as fast as we can. Now, during the peak, some of the services did have to be stopped for clinical reasons, because it was, although my heart goes out to those who died of cancer whose treatment was stopped due to COVID. The judgments were made on an individual clinical basis as to whether it was safer to go ahead with the treatment or to stop it, because, of course, many treatments for cancer are much more dangerous when there's a high amount of infectious disease. So that explanation will be no comfort to Kelly's family and friends who mourn her. I understand that. But I also understand why the NHS made that decision, and I support them in the decision they made. But we must get this going again as fast as possible. This is something I'm working very closely with the NHS on. In fact, I had a meeting on it only last week, and I think that I entirely agree on the point about radiology services too.
Aaron Bell.